Hello everyone, and welcome to a breastfeeding class presented by the Breastfeeding Clinic in the Helderberg Basin in Cape Town, South Africa. Just a quick disclaimer, the information provided in this program is to assist you in exploring all available options to help you to make well-informed decisions, to help you feel in control, be responsible for, and have confidence in your choices. Information should please not be substituted for the diagnosis and treatment of any medical condition, and also please never disregard professional medical advice or delay in seeking it because of something that you have received in this program. And this recording is also not intended to replace professional medical or other kinds of advice. Now in this recording we will be looking at engorgement, and I've highlighted it for you on the list of topics that we are covering in this breastfeeding class series. Now, the hope is that you're watching this recording in preparation for breastfeeding and not because you already have engorgement and desperately need a quick fix. If that is the case, I do hope that the information to follow will help you cope with engorgement. Now, do you think it's normal for a woman to develop engorgement when her milk changes from colostrum to mature milk? You might know it as milk coming in around day 3 or 4. And the answer is no. Fullness is normal, engorgement is not. Okay, so you may know by now, somewhere, just mentioned it, but somewhere between day 2 and 4 after birth, the milk transitions from colostrum to mature milk. Now, the mother in the slide, her breasts are large, or they look large, and they are filled with milk. And her breasts most likely feel warm and heavy and might feel full as well. And what happens here is her breasts are normally full. Her baby can latch easily, her milk is flowing freely. There might be some lumpy areas in the breast. The only treatment that is needed for breasts that are full, when milk supply increases between 2 and 4 days, is for the baby to remove the milk. And the heaviness and fullness will typically decrease after feed, and the breast will feel softer and more comfortable. And within a few days, her breast will have adjusted to the baby's needs and they will feel less full. Now, what do you notice about the breast in picture number 2? Now, this is also a mother a few days after birth, and this mother's breasts are engorged. Now, as mentioned, the fullness in the early days are normal, but over fullness is not. Now, contrary to popular belief, engorgement is not a sign that a woman has a lot of milk. Engorgement is a sign that something has gone wrong. And if engorgement is severe enough, it can actually cause a reduction in the mother's milk supply. Now, engorgement means that the breasts are congested and swollen, partly with milk, partly with lymph, and partly with blood. And this blocks the flow of all three. Now, the breast may become hot and hard and lumpy and painful and look tight and shiny like the breast in picture number 2. And the skin may look red, and the woman actually might have a slight fever. Now, all these things might make you think that it's mastitis. However, engorgement affects the whole breast, and engorgement often affects both breasts, where mastitis usually affects only one breast, and usually only a part of the breast is swollen and hard with redness of the overlaying skin, and the rest of the breast usually looks normal. And a woman with mastitis also has severe pain, and she's got a fever, and she really feels ill. Anyway, the raised temperature due to engorgement usually settles within 24 hours or so. So engorgement usually occurs between day 3 and 5 after birth, but it may be as late as 9 or 10 days, though it's less common with mothers who are having their second and third and fourth babies, etc. Okay, so what do you observe about the nipple in picture number 2? This nipple may be stretched tight and look flat due to a too full breast, which makes it difficult for the baby to attach and remove milk, and this can result in sore nipples. Why sore nipples? Because the baby is having a hard time to latch onto a breast that it's pumped up to 3 bar. So often mothers will say things were great on day 1 and 2, and then when the milk supply increased by day 3, that was when the nipple trauma and the pain started, not realizing it was because the baby couldn't latch deeply. So try it yourself. Try latch onto an apple without your teeth. It's hard to latch deep and get your tongue to create a seal around it. And we'll look at how to help with this in a bit. Here are the differences between full and engorged breasts. With full breasts, the breasts are hot and heavy and they are filled with milk and they may be lumpy in places, but the milk flows freely with full breasts and the mother doesn't have a fever. Whereas with engorged breasts, the breasts are painful, they are swollen with tissue fluid, they are tight, especially the nipple. The breast may look shiny, they may look red, and with engorged breasts, the milk is not flowing freely, and the mother may have a slight fever for about 24 hours or so. I quickly want to talk about lymph. Now, most of you know about the circulatory system, which carries blood throughout our body. And you can see the circulatory system here in the picture. Now, some of you might know about the lymphatic system, which is also part of the circulatory system, but the lymphatic system carries a clear fluid called lymph through the body. And lymph carries away trapped bacteria and dead cells and excess body fluids, etc. And as you move your muscles, it helps move the lymph along. Now, breast tissue is well supplied with lymphatics, but it lacks sources of external compression such as muscle and strong overlying fascia to promote the natural lymphatic drainage found in most body tissues. So lymph has a tendency to accumulate in the breasts, and 75% of the lymphatic drainage for the breast occurs through the auxiliary lymph nodes towards the underarm. So what happens when the breast is engorged? Pressure builds in the breast from milk if the milk is not removed. That places pressure on the lymph system, which then slows and it's unable to move fluids and waste products away, and that then places pressure on the circulatory system or the circulation of blood, and the breast becomes warm and hard and lumpy. So this slide just summarizes the treatment of engorgement. So to treat engorgement, it is essential to remove the milk. And this will relieve discomfort and prevent complications such as mastitis and also help ensure continued milk production. So if the baby is able to suckle, let the baby feed frequently. This is the best way to remove the milk. So let the baby stay skin to skin and suckle whenever they want. If the nipples are sore, apart from doing what is to follow, have the baby's positioning and latch and feed assessed by someone trained in breastfeeding support. Okay, so if the breasts are engorged before feeding or expressing, you can try and position yourself comfortably because this will help stimulate the oxytocin reflex. Have someone massage your back and your neck. Maybe a lukewarm compress, such as a lukewarm face cloth on your breast, or a comforting shower on your back can also help. Reason why we want you to be so comfortable and relaxed is because this is going to help the oxytocin reflex work. If you remember from the anatomy and physiology recording, oxytocin reflex makes the milk flow. So as mentioned, sometimes engorgement and areolar swelling may be so severe that the areolar area becomes hard and the nipple flatten. And then the baby has a difficult time pulling the nipple and breast tissue into the mouth. And if this happens, you could, before a feed, try and soften the areola and make it easier for the baby to attach. Do what we call reverse pressure softening. And this just uses very gentle positive pressure around the base of the nipple in about a 3 centimeter radius around the nipple to soften the area. And it's trying to move the fluids away from the areola so that the baby can latch deep and that the milk can flow through the nipple. All you really need to do is just have clean hands and fingernails. So do this immediately before trying to latch baby or hand expressing or using a pump if your breasts are really engorged. Just with long fingers, maybe your index finger and your middle finger, just place it on the areola at the base of the nipple and then painlessly apply steady, gentle, firm pressure inward on about that 3 centimeter radius around the nipple, directly into the chest wall for about a minute or so. And your fingers could be at the 12 o'clock, 6 o'clock position, and just move your fingers to 3 o'clock, 9 o'clock position and repeat the pressure. And keep repeating it depending on the severity of the swelling. And do this for the next few feeds or perhaps days, every time before feeding or expressing until engorgement has resolved enough for the baby to latch easily and deeply without you needing to do reverse pressure softening. And it works better if you lie on your back. And you need to be quite quick in latching baby or starting to express before the fluids drain back into that area surrounding the areola. And then that causes compression on the ducts and the nipple, and the milk can't flow. And as mentioned, you might only need to do this for a day or two around day 3 or 4. There's some gentle lymph draining massage and gentle massage of the breast may also help the milk flow easier before feeding or expressing. And we'll talk about breast massage to get the milk flowing and hand expressing in a separate recording. Okay, so therapeutic breast massage, that was investigated as a trial to help reduce engorgement. And the general goal of this breast massage was to try and improve the flow of blood and to help the lymph move and to help the milk flow. So some authors suggest attempting to manually move lymph into lymphatic vessels towards the lymphatic nodes are unphysiological. But until we know better, let's do the best that we can with the knowledge that we have. Okay, so start with reverse pressure softening so that the milk can flow through the nipple. Some people also do some gentle fingertip massaging within the areola to reduce the swelling and help facilitate the latch and the flow of milk. And you can alternate maybe very gentle fingertip massaging on the areola with reverse pressure softening. And then some people also do some breast gymnastics. This is very gently. Take your whole breast with 2 hands and gently move your breast up and then back to the starting point and then down and then back to the middle again and then left and back to the middle and then right and back to the middle. And you can do a gentle circle all around. And many mothers comment that their breast engorgement already starts to feel much better when they do this. And then you can very gently press with your fingers towards your armpit a few times, where that red arrow is. If you want to number, maybe say about 10 times. And then make some gentle massaging movements just above your clavicle for a few seconds, where the star is. And then with very long fingers flat on your chest, you can perform some gentle stroking hand motions across your breast, starting at the lower inside of the breast, go over your breast directed towards your armpit, and then from the lower outside again also towards the armpit, because 75% of your lymphatic drainage of the breast occurs through those auxiliary lymph nodes in the armpit. And you can use an oil like olive oil or something to help reduce friction of your hands on your skin. And often milk will start dripping from the engorged breast as the congestion eases. And then mothers can also place their hands on their breast and gently pull the breast with both their hands from the nipple towards the base of the nipple, very, very gently. And then once you've done some reverse pressure softening and lymph draining massaging, see if the areola is soft enough for the baby to latch. Now, if the areola is still not soft enough for the baby to latch deep, some gentle breast massaging and gentle expressing might be needed to help the baby latch deep. And but hopefully the baby will be able to latch and relieve the breast fullness. But we'll talk about, and I said this before, how to get the milk to flow and hand expressing. We'll talk about that in a separate recording. Now, if breastfeeding alone doesn't reduce the engorgement, perhaps expressing milk between feeds for a few days or for a few times for comfort as well might be beneficial. And then after feeding the baby, if the baby fed on only one side to help reduce engorgement on the other side, just repeat this whole process. A lukewarm compress, reverse pressure softening, lymph draining massaging to relieve pressure on the ducts, gentle breast massage to loosen the milk, gentle expressing just enough to relieve, and then a cool compress on both sides. Now, a cool compress could be a cool wet cloth, face cloth, or raw green cabbage leaves placed in your bra on your skin, or those fancy breast reliever gel packs. Now, as mentioned, some others like warmth, like a wet cloth, face cloth, applied on their breast before breastfeeding, just to help with the milk flow. Now, a relaxing shower, as mentioned, can also help. Though after feeds, we want the cloth or other compress that you use to be cool. Now, remember, with engorgement, there is an increase in blood, lymph, and milk. And the idea that warmth can relax ducts and allow the milk to flow only really addresses one of these three fluids. And since we cannot guess how much of each of these, the blood, lymph, or milk, contributes to engorgement, treating just one of these with heat may not be ideal. So cold will decrease flow, it will decrease swelling, and then the milk can flow. So cold will address all three. Now, studies haven't demonstrated cabbage leaves to be more effective than ice wrapped in a towel. And there's a worry that cabbage leaves may carry listeria bacteria. So it's not essential to use cabbage leaves, but if you are going to use green cabbage leaves, it can be used either chilled or at room temperature. And then for engorgement or oversupply, I would just say limit the use of cabbage leaves because it could potentially decrease milk supply. So discard the outer possibly sprayed leaves and peel off one or more cabbage leaves, wash it, tear out that hard vein, maybe crumple each leaf gently by hand if needed, and then place the leaves on the breast. Leave the nipple open because you're going to cover the nipple with a breast pad. And then hold the leaves in place with a bra. And it should feel nice and cool. And then after about 20 minutes, when the leaves become warm and soft, just throw the leaves away and repeat the whole process with the next feed. So, breast A, with the engorged breast, do some reverse pressure softening. Nipple is soft, baby areola is soft, baby can now latch deep. Let baby drain the breast and then apply a cool compress to that breast. Breast B, that baby did not feed off because he could fill his tiny tummy on breast A. Apply a lukewarm compress for a minute or so. Do some reverse pressure softening so the milk can flow through the nipple. Do some gentle lymph draining massage to relieve the pressure on the ducts. And then do some gentle breast massaging to loosen the milk and gentle expressing just enough for relief. And then a cool compress on the breast to reduce the swelling. And then next feed, start feeding baby on breast B and express breast A just enough for relief if baby didn't take breast A. Now, please don't limit the feed so baby can feed from both breasts. Let baby finish one side before offering the other. I'm not saying baby may only feed from one breast per feed, but you need to let baby finish one side and drain that breast. And then if baby didn't take the second one, you can just express that one enough for relief. Anyway, as mentioned, discontinue the use of cabbage leaves as soon as the engorgement begins to subside or within a maximum of 24 hours or so. Now, day 3 and 4 are usually the hardest. That's literally and figuratively, and things will soon settle. But please see a medical professional for any persistent symptoms or severe engorgement. Okay, so we have looked at how to cope with engorgement. I just want us to take a quick look at how to prevent this from happening in the first place. Now, this slide shows some causes and the important ways to prevent it, because prevention is so much better than cure. Now, some of the causes could include a delay in the initiation of breastfeeding after birth, infrequent milk removal. This is the most common cause. Anything that interferes with regular breastfeeding, like a sleepy baby or limiting feeds or supplementary bottles, could lead to infrequent milk removal. restricting the length of feeds. That could also lead to engorgement. Maybe ineffective attachment, and then the milk is not removed effectively. Intravenous fluids given during labor, that can result in excessive fluids in breast tissue, leading to postpartum engorgement and swelling, making latch on difficult. Now, in addition to discomfort, if milk is not removed from the breast, the feedback inhibitor of lactation can also start to decrease milk production. Now, prevention is very closely related to the cause of engorgement. Just follow the practices to the 10 steps to successful breastfeeding to prevent engorgement. The baby should start breastfeeding as soon as possible after birth without restriction on the length and frequency of feeding. Keep that baby skin to skin room in with baby. Practice responsive feeding. Make sure the baby is effectively attached. And if the baby is not transferring milk effectively, or if the baby is separated from the mother, start hand expressing ASAP. Because with hand expressing, the milk pressure is less likely to build up in the breast and engorgement is less likely to occur. Just interesting study found that there was a reduction in engorgement in women who expressed colostrum once or twice a day for about 30 minutes. So in the study, the mothers didn't, the babies didn't have free access to the breast, and the feeds were limited to 6 or 8 feeds a day. But the findings do suggest that early and frequent breast emptying in this population may help prevent engorgement. So if you suspect there's going to be a problem, maybe just, even if the baby's feeding nicely and you worry there's going to be issues, just hand express between feeds for 30 minutes or so the first day or two. Okay, thank you so much for watching this recording. In the next recording, we will look at early management goals and how to cope if things don't go as planned. So please visit the Breastfeeding Clinic at www.breastfeedingsa.co.za if you want to book a private consultation and receive the class notes, and you can also navigate the class recordings easier from the website. And feel free to subscribe to this channel for more breastfeeding class recordings. And take care till next time.